In this video, we'll discuss blepharoplasty or eyelid lift surgery. As much as any other single facial characteristic, the eyes have an enormous influence on your appearance. The aging eyes with bags and droopy eyelids can convey a tired, sad, or upset appearance, even if this is not the way that you feel on the inside. The sagging of the upper eyelids can create a tired or disinterested look. Those puffy lower eyelids may be considered an indication of worrying, fatigue, or lack of sleep. Here at Prima Center for Plastic Surgery, blepharoplasty surgery, otherwise known as eyelid lift surgery, is frequently performed on both men and women to rejuvenate the eye area. We correct the signs of aging in order to create a younger, brighter, and more cheerful look. The eyes are often the first areas of the face to show the external signs of aging. Thin skin of the eyelids has very little in the way of internal support. As the skin ages, it loses strength and begins to sag. This sagging, combined with years of sun damage and stress, all take their toll. The appearance of the face as it ages is characterized by progressive wrinkling, changes in the thickness of the skin, and loss of fatty tissue. If you compare pictures of yourself taken from decade to decade, you'll see some very distinctive and predictable changes. The first sign of aging is usually in your 30s. At this time, the skin begins to lose some of its elasticity. By your 40s, some of the wrinkles will begin to appear in the forehead. There may also be a progression of the sagging of the skin of the upper and lower lids. The crow's foot areas will begin to appear and deepen. The general sagging of the face continues with increasing overlap of the skin of the lids. Eyelid surgery attempts to correct the signs of aging in order to create a more youthful and cheerful look. It is important for us to understand your expectations in order to clearly discuss the results that can be reasonably obtained. A complete preoperative exam concentrated on the eyelid area must be performed. At this time, you'll be checked for eye function, the possibility of excess looseness of the lower eyelid, tearing, and the degree of excess fat. A blepharoplasty can be done in either our certified office operating suite or in the outpatient area of the hospital. It is typically done under either local anesthesia with oral sedation, twilight anesthesia, or in some cases under general anesthesia. On the day of your surgery, you'll be initially checked in the preoperative area. Using a ruler or a caliper, we will carefully measure the amount of skin to be removed and the location of the incisions. These marks will serve as a guide to the actual surgery. Next, you'll be escorted into the operating room and the appropriate anesthesia will be administered. The upper eyelid incisions are usually made first. The incision will follow the natural fold of the lid and will extend to the outer portion of the eyelid, then out into one of the crow's foot creases. By placing the incision in this crease, the fine scar will be well camouflaged when the eye is opened. An ellipse of skin and a portion of the muscle are removed and the excess fat is gently teased out. The skin is then closed using very fine, delicate stitches. For the lower eyelids, the incision is made just below the last margin and is extended out into a crow's foot wrinkle or a natural laugh line. The underlying excess fat is then either carefully removed or more commonly relocated to fill in contour depressions. This gives a more youthful fullness to the lids and avoids a hollowed out appearance. Next, an appropriate amount of lower eyelid skin and muscle is excised. On occasion, we must tighten the ligaments that support the lower eyelids as well. The entire procedure usually takes 1 to 2 hours, depending upon the severity of the condition. We will immediately apply cool saline compresses to the eye area to decrease swelling, bruising, and discomfort. Many patients return to work in as soon as 5 days. The results of a blepharoplasty are not permanent, but they can be dramatic. No type of plastic surgery can stop the aging process, but this surgery can do wonders in restoring your youthful appearance. The average person can expect the surgery to last about 7 to 10 years. Most of our patients feel that they come away from the procedure with a fresher, crisper, and smoother appearance around the eye area. The procedure will not completely eliminate all wrinkles around the eyes. The results of a specific procedure will vary greatly from patient to patient, depending upon the degree of wrinkling and the overall quality of your skin. For more information, please go to our website, primacenter.com. Thank you. process.